This study explores the relationship between moral values, emotions, and attitude stability on social media, focusing on COVID-19 vaccine hesitancy. By analyzing nearly 1 million tweets about COVID-19 vaccines collected between March 12, 2021, and May 11, 2021, the authors aim to understand how moral and emotional language is used differently in pro- and anti-vaccine tweets, and its impact on users' expressed stance over time. The dataset consists of 913,416 users, with 3,547,645 pro-vaccine, 2,928,820 neutral, and 335,389 anti-vaccine tweets identified using a stance detection classifier. To measure variation in stance per user, the standard deviation of stance expressed across their tweets was calculated, revealing that 310,258 users expressed a consistent stance, with an average standard deviation of 0.62. Moral value and emotion extraction were performed using the NetMapper software, recording the number of concepts representing each moral value: care, fairness, liberty, sanctity, loyalty, authority, and emotion: happiness, sadness, fear, anger, disgust, surprise, in each tweet. The results show that anti-vaccine tweets contain more moral and emotional language, with significant differences in the use of purity, liberty, and authority moral foundations, as well as anger and fear emotions. The findings suggest that emotional language in tweets about COVID-19 vaccines is largely associated with more variation in stance of the posting user, except for anger and surprise. Furthermore, the strength of COVID-19 vaccine attitudes associated with moral values varies across foundations, with liberty consistently used by users with no or less variation in stance, and fairness and sanctity used by users with more variation. These insights have implications for designing constructive pro-vaccine messaging and identifying receptive audiences. Understanding moral and emotional antecedents of attitude strength can reveal which individuals are most receptive to public health messaging, ultimately contributing to more effective health campaigns. Here is a combined summary of the 4 pages. This study investigates the relationship between moral foundations, emotions, and the stability of attitudes towards COVID-19 vaccines on social media. The analysis reveals that anti-vaccine tweets contain more references to care, fairness, authority, sanctity, and liberty foundations compared to pro-vaccine tweets, which contain more loyalty terms. Additionally, anti-vaccine tweets exhibit a higher frequency of sad, fear, anger, disgust, and surprise emotions, while pro-vaccine tweets are characterized by happiness. T-tests comparing the use of moral and emotional language by users with no variation versus any variation in their stance show that users who consistently express a single stance tend to use anger, loyalty, care, and liberty more frequently in their tweets. Conversely, users expressing variation in their stance are more likely to use happy, disgust, surprise, fear, or sad emotional language and refer to sanctity, authority, and fairness foundations in their tweets. An OLS regression model predicts the standard deviation of expressed stance across tweets for each user, given the use of moral and emotional language, indicating that more emotional language is generally associated with more variation in stance, except for surprise. Liberty and loyalty are associated with less variation in stance, while the remaining moral foundations are associated with more variation. The findings suggest that the moral foundations and emotions expressed in tweets about COVID-19 vaccines play a significant role in shaping the stability of attitudes towards vaccination. The differences in moral and emotional language usage between pro- and anti-vaccine tweets may reflect underlying beliefs and values that influence the stability of attitudes on this issue. The study's results have implications for constructing effective campaigns to promote vaccines and debunk vaccine misinformation, and future work should assess the use of moral values and emotions towards vaccine attitudes on other platforms. The study delves into the interplay between moral values and vaccine hesitancy in Great Britain during the COVID-19 pandemic, focusing on the role of moral and emotional associations with attitudes towards vaccines. Utilizing a dataset of nearly 1 million tweets, the research reveals that moral and emotional language is more prevalent in anti-vaccine tweets, with exceptions for happiness and loyalty. Emotional language is associated with larger variation in stance, except for anger and surprise, which are linked to consistent stances. Moral language's impact on stance variability differs across values, with liberty associated with consistent stances and fairness and sanctity linked to greater stance variation. This work highlights the importance of considering moral values and emotions in public health messaging, particularly in counter-misinformation campaigns. The paper also explores the influence of policy change threat on financial contributions to interest groups, as well as the psychological meaning of words in computerized text analysis. It emphasizes the need for a more nuanced understanding of vaccine attitudes, acknowledging that they are often complex and multifaceted. By examining moral and emotional reasoning in attitudes, the study aims to identify receptive audiences for public health interventions. This research contributes to the ongoing discussion about the role of moral and emotional factors in shaping vaccine attitudes and behavior.